going to talk a little bit about hip pain, how to get relief from hip pain, and we're privileged to have one of our very talented members of the medical community here in the Battle Creek area. From the Bronson orthopedic specialist, Dr. Joseph Burkhardt is with us. Good morning, Dr. Burkhardt.
Good morning.
Nice to have you back again. And you've also brought a patient, Duane Knight, he retired from the Battle Creek Police Force. Hi, Duane.
Good morning, Tim.
Working for the county prosecutor now, are you?
I am.
Yeah. And, we'll chat with your experience about hip pain here in just a little bit. By the way, the morning show brought to you by the Battle Creek Community Foundation, Turn Belief into Action. Well, hip pain, I guess we all get it from time to time, but when you've really got it in earnest, it's a life-changing thing. What's causing hip pain, Dr. Burkhardt?
Well, hip pain is, there's a variety of different areas around the hip that people describe as hip pain. There's the posterior buttock pain, which is typically a sciatic nerve-related thing. And then there's anterior hip pain, which is usually from the socket, and lateral hip pain, which typically comes from the bursa. So soft tissue causes and joint-related causes. When you're talking about the joint, it's usually related to degenerative changes in the joint.
Mm-hmm. So your first job is to figure out what type, and then you can start plotting a course of action.
Yes.
So for listeners who have hip pain, what are some non-surgical options then that you use to help relieve that pain?
Usually what we try and do is use simple things that are accessible, over-the-counter anti-inflammatories if the patients can tolerate them. Tylenol, weight loss, exercise, things like that to see if we can buy more time before operative intervention really is indicated.
Mm-hmm. Yeah. But so when it gets to the point that non-surgical options just aren't going to help relieve the pain, then what do you do?
Well, then we move into replacement options. For example, a traditional hip replacement versus like a hip resurfacing. Those are the sort of the two directions you can go.
Well, let's talk about hip resurfacing. I really hadn't heard of that before. What's entailed in that?
So hip resurfacing maintains the bony anatomy on the femoral side and basically caps the top of the femur and relines the socket with a socket that rides on a fluid film. So the normal lubrication of the socket is what the implant rides on. So it rides on carbide icebergs within the implant itself, lubricated by normal joint fluid. The reason this is an advantage for patients over a traditional hip replacement is the bearing surfaces riding on fluid film, which does not allow the implant to contact the other side. So you can abuse this much more so than a traditional hip replacement. And so you can return to activities such as farming, rugby, running, distance running, where we discourage that with traditional hip replacements more often.
Now, resurfacing, that's something that you underwent, Duane. Tell us, what it had gotten to before you had that done as far as your job and your just general lifestyle.
Well, it all started back in spring of 2017. I was training for an Ironman. That's a discipline of a swim, bike, and a run. And the run portion was a 13-mile run, so I had to do quite a heavy load of running just to be prepared for it. Well, I started experiencing hip pains, and they weren't going away. The more I ran, the more it hurt. I went to two different doctors, and they both diagnosed me with what they thought was sciatica.
Mm.
Well, I went on to do the race, and I limped the entire 13 miles. It was painful. I did finish within the allotted time, but the pain wasn't going away. So at the advice of some friends, I went to see Dr. Burkhardt. He completed his testing. He did a series of tests. It was very thorough. And at the conclusion, he said I need to do a hip replacement. I explained to him that I still enjoy the sport of triathlon, and he said, well, I would possibly be a candidate for the Birmingham, which he just had discussed.
Mm-hmm.
That being said, he said he wouldn't know until he operated to see how much structure was left.
Was this one hip or both or?
This is just my right hip
Okay.
at this time.
Mm-hmm.
So anyway, he did the surgery. Excellent job. And upon completion, he said I was a candidate, and he did the Birmingham. I went into the operation at Bronson Hospital in October of 2017, and I was able to, with that procedure, I was able to take a year off. He said if I took a year off, I could resume training for another half an Ironman, which I listened to him, because his advice to me is listen to your body, and I take that very serious. So I did start training in this June. I did complete another half an Ironman in under 7 hours and 30 minutes, and virtually pain-free. Of course, with the distances, you're going to have pains. That's just normal, whether you have a hip replacement or not. But outstanding job by Dr.
That is remarkable. Now, when you say you took a year off, Duane, you mean just from heavy training. But what was the general lifestyle like after the procedure was done?
Well, it was a one-night stay in the hospital. Excellent care at the hospital. My lifestyle was restricted for about a week.
Mm-hmm.
That's not normal. The doctor said I probably should have taken a couple extra weeks off. I was able to go back to work within a week. I had to have a driver for a couple of weeks because of the medication, but it was a lot less painful than I thought it was going to be. And I immediately, within 6 weeks, I was back to normal. It took a little longer, probably 2 months, to walk right, because my leg continued to kick out to the right. But just through continuous walking, I was able to get back to 100, in my opinion, 100%.
Well, you look in fabulous shape, Duane. So I think that's pretty fortunate. And Dr. Burkhardt, contrast that with the next step, which was like the total hip replacement. I mean, probably a lot more recovery time and a lot more to it.
Well, both. I consider both procedures the best operation we have in orthopedics. Hip replacements work very well, whether it's a resurfacing or a total hip. When you're talking about pain relief, they both relieve pain the same way. The advantage to the resurfacing is what you can do with it after. But as far as pain relief and function and outcomes, they're both very effective in resolving the problems associated with a worn-out hip. So they're just different approaches to fix the implants to bone, and different bearing surfaces to allow different activity levels.
I had a coworker almost 30 years ago here that had a hip replacement. He was a fairly young man, but at that time, I remember people saying, well, you want to wait as long as you can because it's a one-shot deal and they can wear out after a while, and then you have a disability the rest of your life. Has that changed over the years, or do we still try to wait?
You know, the materials are so much more resilient to wear than they used to be, so that has changed. There are a lot of different bearing surfaces that are pretty resistant to wear. So the lifespans that we expect are much, much longer than what you would hear 15, 20 years ago.
How long do you, I suppose it really varies a lot, patient to patient, age and, their weight and their physical ability. But, I mean, how long do you expect a hip replacement to hold up these days?
You know, it's my hope is that they have one operation and that's all they need for their lifetime. Mm-hmm. Like I said, the bearing surfaces are so much more resistant to wear. So my hope is that, if you're 65 and you get a hip, and most people live to 80 or 90, that will last that long. Same with the Birmingham hip. I mean, the European explant studies where they evaluated the wear on that bearing, after 30 years, they're still in there functioning. So it's just a guess how long they're going to last, but much, much longer than the old comment that this is going to last you 10 years and you'll have to have it redone.
Yeah. And amazing what a life-changing procedure that both of these are. I mean, you see people who can barely walk, and then all of a sudden you see them a month later and they're walking just like, nothing ever happened. Yeah. So it is really amazing. Now, you're going to do a presentation on hip pain relief, and it's coming up the day before Halloween, a week from tomorrow, October 30th, 5:30 in the evening, which is convenient for a lot of people, over at the Bronson Battle Creek Outpatient Center, and that's, 300 North Avenue, right?
Yes.
And so you can register. It's free on bronsonhealth.com/classes or Bronson Health Answers. Here's an 800 number for you. And by the way, I'll put this stuff up on the website later, too, so people can just go to WBCK 953WBCK.com and get the stuff. But here's that 800 number, 800-451-6310. And you make same-day appointments at times for people who desperately need it at your office, right?
Yes, we do.
What's the phone number over there at your office?
269-979-6360 or 1-877-704-3133.
Yep, and you can always visit bronsonhealth.com /same day if you need to make an appointment with Dr. Burkhardt or any of the other Bronson docs. Very interesting. It is, when you see technology make a leap like it has in the last few years that can really change people's lives, like yours, Duane. I mean, my goodness, who would have thought that you could still do the rigorous kind of training and athleticism that you've become accustomed to with a problem like that?
Yeah, I'm getting ready to do a full Ironman next month, and so I'm up to. I ran 20 miles last Thursday. The hip is perfect. It's doing a tremendous job. So,
wow.
With a little luck, I'll finish in under 15 hours. So.
Well, good luck to you, and very nice to meet you, Duane. Dr. Burkhardt, nice to have you back here again. Keep up the great work.
Thank you.
Thank you.